Hello, everyone. Another evening for us in Toronto, and I know other parts of the world. Maybe you are midnight or you are in the morning person, and you can watch this video to us for with us. Actually, today I'm very excited. We have Dr. Shiroko Sokitch. She's a medical doctor and functional medicine and medical acupuncture practitioner. She has all the skills that I'm really interested in here, and you have this opportunity to ask her questions, whatever you want. And we're gonna talk about something great about her book as well, and her own story about health, and to know that nothing is impossible if you have any medical issue, and already got a lot of rejection from medical doctors. There are still hopes, and we are here to discuss about this issue with you. Thank you for being part of the show, Dr. Shiroko.
Thank you for having me. I'm so sorry that I'm in a car dealership, but that's what happened.
No, it's good to be on time, and I'm really excited. It doesn't matter where you are.
Oh, good. I'm
Since,
glad to
yeah,
hear
we
that.
have
Yeah.
you. Yeah, great. Okay, tell me about yourself first.
Okay.
First, your story, if you had any health issue, anything. And then I know you are medical doctor, general surgery, and you work in emergency as well. So you've been in medical for years, right? 30 years?
Yes. Yeah.
Yes, yes.
Been around for a while. Yeah.
Wow.
Yeah.
So tell me
Yeah.
about yourself.
Well, many stories. The reason I do what I do is when I was 5 years old, my great grandmother was my very best friend, and my mom was a single mom, and my dad had left when I was 3.
Oh,
So I had already lost somebody. And when my great grandmother and I would hang out all the time, and one night we were playing together and she suddenly passed out on the floor.
wow.
And I couldn't wake her up. And I ran to get my mom and my grandma, and they called an ambulance and she got taken away to the hospital. And a few days later, my mom came and told me that my great grandma had died,
Oh,
and that I would never see her again. And I was devastated. But in that moment, she had also told me that her heart had stopped beating. And in that moment, I began to try to imagine a miracle that would bring her back to me. And I started to imagine a machine that would make her heart start beating again. And it's basically then that I decided I wanted to be a doctor, and that I sort of started my belief in miracles. And, my whole life, my whole career has been dedicated to helping people have miracles in healing. And it's taken years to get to where I am. Fast forward many years to medical school. And the first time I got to save a life was when a guy came in with a gunshot wound to the emergency room, and we got to take him to the operating room and save his life.
wow.
So I started my career as a surgical resident because that was what I thought would save lives. And I've evolved over time. And as I began to realize that even the best that medicine has to offer sometimes didn't help people. So, as a surgical resident, I began to see problems that we couldn't solve with the best skills that we had, and I was like, "Why? What can we do? How can I help more?" And somebody gave me this book called "The Web That Has No Weaver," and it's about Chinese medicine. And I just fell in love with the whole idea when I started to read about it, and the idea that your body's made of energy and energy travels through your body, and when it's out of balance there are problems. And I was like, this is the thing that will help in addition to what I already do, so I went to acupuncture school, and I started working in the emergency room and going to acupuncture school, and putting the two together, the Chinese and the Western medicine together. And over the years, that's what I have evolved to do, because I feel like both tools are necessary in order to help people be well. So,
Yes, actually, The reason we have this show and we are talking right now, all the
Mhm.
months interviewing people,
Mhm.
actually it's year right now.
Mhm.
That's because I believe it too. I
Mhm.
believe that Western and Eastern medicine should integrate to each other with each other, because the reason
Mhm.
is your mind and body is connected to each other.
Exactly.
Yes, so
Exactly.
you
Yeah.
cannot just diagnose the symptom and just go and recover from that symptom, but that symptom
Mhm.
may have a lot of layer inside.
Exactly. Yeah. Yeah.
All right. So, what's the difference for
Mhm.
you when I know you've done functional medicine as well. So,
Mhm.
why did you learn about functional medicine at the second place, right? You first
Yeah.
learn about the acupuncture, then you've been in functional medicine.
Well, again, so always looking for miracles, always looking for healing and the way to make people feel better the best, right? So with acupuncture, there were limitations. And part of that is trying to understand the root cause of what's going on with people. And so over the years of practicing acupuncture, and one of the cool things about Chinese medicine is that there are tools for looking at your body differently than in Western medicine. And so it's useful to help you understand your own body. I'll give you an example. The kidneys regulate your low back, your knees, your bones, your overall sense of having energy, big transitions in life, the emotion of fear, and your power of will. And in Western medicine, they regulate your water flow and the balance of fluids in your body. Well, that they also do that in Chinese medicine. So you have this overlap of Western and Chinese, but a whole lot more functions. So somebody who has low back pain or knee pain or has the physical matter of their brain, so if they have trouble thinking, those are all connected to the kidney, and they can begin to start thinking about, oh, okay, here's an imbalance that I'm experiencing, and then you can learn what things you can do about it. So that's what my book is focused on, is helping people understand their own bodies and learn to use the information to help themselves.
Yes, and the name is Healing When It Seems Impossible. That's exactly the name of your
Yeah,
book, and
yeah.
it's accessible through Amazon, right?
Yes, exactly. Yeah.
Yes, beautiful. Okay, what was your own health issue? Did you have any health issue
Oh
that
my goodness.
yeah.
I think I've had many health issues over the years. Like probably the most difficult over the years has been irritable bowel syndrome since I was 16. And my self-education process of learning how to heal that and figuring out what would make it better has and in my life experience, I have found, I've had different health issues that take me years to figure out. And I think part of that is my path as a healer, is to really go through all the different ways that a thing can be a problem. So with my irritable bowel, at different times I've had, stool tests that showed various kinds of infections, such as candida, figured out that I had various food allergies, figured out that I had SIBO, like different over the different tools, different things that I had to do to myself in order to help others. Same with, I used to have migraines, and I started having those when I was in my 20s, so right around medical school. And so then I had to figure out how to deal with migraines and what to do about them. And again, it had to do with foods and digestion and various things. And so all of these journeys that I've been on have helped me help others, but also helped me figure out all kinds of different science in order to pull in all these different tools in order to help people better.
Exactly, that's nice.
Yeah.
My mom has a migraine for
Mhm.
years, and she is really addicted to taking Excedrin and other pills.
Yeah.
Uh, but sometimes I get migraine too. I don't have migraine specifically,
Mhm.
but sometimes I have headache, like
Mhm.
low blood pressure. But
Mhm.
what I do, I just go and sleep. That's it. I don't take
Mhm.
any pills. So in
Mhm.
my whole life, if I don't really have to, I never take pills,
Oh,
and it's really
congratulations.
worked for me. Yeah, yeah, it's good. I
Yeah.
try to be healthy, but it's still, you are not
Mhm.
perfect, and I'm not really. I
Mhm.
try to use those skills that I learned, and I
Mhm.
really understand that diet, movement, and have a green lifestyle really help us get better and
Mhm.
improve our life.
Yes, that's true. Yeah.
Yes.
Mhm.
So give me some example of part of your book, Healing with It Seems Impossible. Some
Okay.
story if you have inside, if you have any great practice or medical miracle that help your
Mhm.
patients.
Well, so one of the reasons it's called healing when it seems impossible is because I help a lot of people who have issues that are not easy to fix, or who have been to many different doctors and had different approaches or not gotten solutions. And there's a certain set of symptoms that a lot of people have that are getting more and more common. And so part of it was that. Part of it is my own personal story. I went through a divorce that broke my heart about 10 years ago, and it seemed impossible for me to ever become a whole person again at that time. And the book is Healing When It Seems Impossible: 7 Keys to Defy the Odds. So there are 7 keys that I have discovered or figured out over the years of what I do with clients, as well as how I healed myself. And the first key is love. And one of the things that I've always taught my clients is that your body is your friend. And a lot of times when your body's bothering you or it's not getting along with you, we feel like that it's our enemy, and we're angry and we feel betrayed, and we say, I just want to get back to who I was before. And the journey of getting well from something that's difficult to A, discover, and B, heal from, is a healing journey on a emotional and spiritual level, as well as a physical level.
I like
And
that
so
word.
all of those elements are involved, but love is the what I call the our superpower. So
Yes,
if we start with love and we bring love to the whole equation, like what if you loved your body? What if your body was your friend and you treated it like that? Then what would the answers be? They'd be different. Like if you didn't treat it like a war on something or a war on your own self while you're trying to get well. So I start
so
with love because of that.
so let me go to like 5 second commercial. I'm saying and come back.
Okay.
Please subscribe to Panta Calhoun Transition channel and order my book Naturally Conceived through Amazon. Thank you for watching.
That's very cute.
Thank you so much.
Yeah.
Yeah, that gives me some breeze. Sometimes my daughter come in and she interferes, so I use this
Mhm.
commercial sometimes. Yeah. All right. So you wanna give me other example from
Sure.
uh,
Yeah.
second, probably.
Yeah, the second key is the physical balance. So, one more thing about love. It's very important. Our heart actually sends more signals to our brain than our brain sends to our heart. And our heart produces hormones. So, our heart is an organ that is even more profound than we think of it, because of course we know you can't live without your physical heart, but your heart does so many things that connect it to your spirit. And in Chinese medicine, the heart is the house where your spirit lives. And so it does so much more. And one of the hormones it produces is oxytocin, and oxytocin is the love hormone. And that's why I tell you to focus on love as you begin a healing journey, because if you bring oxytocin in, you'll feel better right away. So that's
Yeah.
that's the first hint. The second key is physical balance. And because I'm a physician and an acupuncturist, of course I'm going to work on your physical body no matter what, because finding physical balance will help you heal your whole self. So there are two main elements to that. One is what I call the triangle of wellness, which is your hormones, your immune system, and your nervous system are is the triangle of wellness. And even if you have no idea what's going on with you or what the root cause is, if you get those three elements in balance, your body will have the tools that it needs to heal itself. So sometimes many people will come in and have a problem that we don't have the answer to. And if I work on their hormones, their nervous system, and their immune system, it will begin to fall into place. I can give you a story if you'd like.
Yes, please.
I have a client who came in. He was a Vietnamese man, and he started having crushing chest pain in the middle of the night. All of a sudden, he was about 50, and he worked for some big company, and he just was like unable to function. The pain was so severe. And he went to the ER, of course, because at 50, you'd think a heart attack. Well, he had all the tests. There was no heart attack. They couldn't find anything wrong with his heart. But he had this crushing chest pain every day, and he couldn't sleep at night because of the pain. And it wasn't from his digestion, and it wasn't from his physical heart. So I saw him, and I could tell that there were some hormone imbalances because he was around 50, and there were hormone imbalances. So I started working with his hormones. I did acupuncture to help his hormones and his immune system and his nervous system begin to come in balance. And he had a fever as well. So I thought, well, maybe he had some virus that we didn't understand. So I started working with his immune system to help him fight that off. Within the first week, he was able to sleep through the night.
Wow.
And within a couple more weeks, the chest pain started to go away, and he had more and more normal days. And by the end of the first month, he was able to go back to work.
Wow. You're
And
amazing.
in that time, he had been sick for a month before he came to see me, and his family was in dire straits because he was the income provider, so they needed him to be there.
Yes, beautiful.
So even if you don't know what's going on, if you work on this triangle, then you can get the tools so that your body can heal itself. And that's what I did for him. And then the second element of physical balance is finding the root cause. And, there's a lot of reasons that a thing can occur. Like, let's say if you have arthritis, well, that can be caused by a injury. It can be caused by an infection. It can be caused by foods that cause problems in our digestive system. So something called leaky gut. So there's a lot of possible reasons that you would have arthritis, but it doesn't necessarily mean that it's a life sentence. And by finding the root cause and addressing the root cause, then the arthritis will naturally go away.
Wow.
So, and this is how I use both Chinese and medicine and functional medicine together to get these systems in functioning at their best and to get your body doing what it needs to do in order to be well.
You have a great integration of everything. Like
Yeah.
what I'm saying, I wish I could find you during those years of a struggle with fertility myself.
Mm, yeah.
Because
Yeah.
it's so important. Like medical doctors, I always admire them for
Mhm.
what they do. They do a lot of sacrifices and they
Mhm.
studied a lot. But the problem is, not all doctors go deeply inside the root cause. And
Mhm.
by seeing the symptom, they simply say, okay, you have this issue, and then this issue never gone and
Mhm.
conceive.
Right. Yeah.
Yeah. So
Yeah.
for chronic disease, let's say
Mhm.
for asthma, um, I've been in asthma treatment for years.
Mhm.
And from one doctor to another, they just threw me and then they said, use this puff, that's it, you know. But as soon as
Mhm.
I try to, uh, try to have better diet and have a better lifestyle. I try so many things
Mhm.
myself, and I feel much much better now. But as I said, with this chronic disease, some people may have it for years.
Mhm.
Like my brother has asthma as well. He
Mhm.
still use puff, and I said, "Oh, you have to go and find the root cause of your issue." Because
Mhm.
now
Mhm.
I understand, when you have inflammation and you eat lots of inflammatory foods, you may
Mhm.
have mucus, and that's why you have asthma, and that's why you have infertility. You see, everything is kind of related to each other.
Mhm. Exactly. Exactly. Yeah.
Yes, yes.
Yeah. So, I mean, and for like I have had patients who had asthma. A lot of times that has to do with some reaction to something either in their environment or a food that they eat or a digestive problem because in Chinese medicine, the lungs and the large intestine are connected and the skin. And so there's this triad of large intestine, skin issues, and asthma all connected. And finding the balance there and helping the person resolve that is the journey, right? Yeah.
So, do you have right? So, do you have an office? Because I'm not sure. Do you do the surgery as well right now,
No,
or
no, I haven't done
uh,
surgery in many years. Yeah.
so you
Yeah.
have the office
Yeah. I
as
have an office in Santa Rosa, California,
uh-huh.
and I still see patients and actually have a telemedicine practice. So I see people remotely.
Wow, so I can actually, because I
Yeah.
have a lot of clients with a lot
Hmm.
of issues, and I can refer them
Thank
to
you.
you.
That would be
Yes,
lovely. I
why
would love
not?
that.
Yeah.
Yeah.
My purpose is finding the root cause of my client's issue
Hmm.
by, and whatever I can cooperate with different
Mm.
doctors and different holistic medicine. The problem is with the acupuncture, they need to be in the same region.
Exactly.
Yes,
Although I
yes.
have figured out a way to do acupuncture remotely. So,
Really?
yeah.
Oh, you're
Yeah.
smart. That's good.
Yeah.
Okay, great. So tell me about your website. Do you have any freebies for us?
Sure.
Yeah.
Well, you can have a sample chapter of my book. There's a chapter called The Hero's Journey, which talks about so when you have a health challenge that's difficult, the sixth key in my book is about never giving up and not letting yourself like using this challenge as a hero's journey because what happens when you have a difficult health issue, if you really go through the pathways, there's a reason behind it. Besides the physical, besides the challenge that it is, we all know that if we have somebody that we don't like working with at our job, or if we have a relative who's difficult to work with, um, we have to deal with them, right? But when your body's difficult, we don't think of it as our school. We think of it as just, why is it bugging me? I just want it to get better. So the hero's journey is when you have a difficult problem and you're getting an invitation from your body to go on an adventure. And so instead of feeling like angry about it, find a team like in the Lord of the Rings, for example, or the movie The Matrix. I love hero movies, and I think because this is why, because it always seems impossible. It always seems like we're not going to find the answer, and we dig and we dig and we dig, and then maybe we're close to getting the answer, and then it all looks like it's going to fall apart, and then suddenly you find something that solves the whole thing, right? Or at the very last second you throw the ring into the fire, like in Lord of the Rings. So I have a sample chapter called The Hero's Journey that you can get on my website, and my website is hearttoheartmedicalcenter.com. And there's also a book on how to choose supplements and getting the right supplements and what those are that you can get for free on my website. So lots of
Wow.
choices. Yeah.
Thank you so much.
Yeah.
I will
My
get your book, definitely.
Thank
Yeah.
you. It's available on Amazon.
Yes.
And you can also click on the link on my website. So everything's available on my website. So it makes it easy.
Yes.
Mm.
Do you have any last recommendation for my audience how to take care of themselves, especially during this COVID?
Oh, well, many. So, you threw COVID into it. So there's a lot, but the main key is really to focus on love and loving yourself, loving the people around you, and maintaining connection. Especially during these times of lockdown that we've had, it's been hard and challenging and stressful for people with all of the things happening. And if you just really work on connecting to love, and I don't know if your audience is a lot of fertility, since that's one of your specialties, but with fertility, the same thing. If you are wishing for a child, one of the things I always say is imagine the love that you're going to have for that child and imagine that connection. So almost as if that child is already there and that you already feel that love. And as you do whatever it is you do on your fertility journey, keep imagining your baby coming to you.
Wow.
And that'll help open the doors for whatever needs to come to you in order to help you.
I love it. Yes, I've done the same thing for myself. I
Mhm.
always imagine that she actually sleep in my
Mhm.
shoulder,
Uh-huh.
and then
Mhm.
with all thing that I had in my dream, I
Mhm.
always say this dream cannot be fake. That's
Mhm.
true. It's gonna happen. And then I just continue visualizing it in my mind, and it
Mhm.
happened.
Yes.
Yes.
There are not very many women who can say they got women pregnant, but I've helped a lot of women get pregnant.
So
So,
yes,
yeah.
we have a comment if you can. I
Mhm.
was diagnosed of cancer 2016. So I've tried all I can to get cured, but all no available until I saw a post in herbalist. Okay, I don't know. She has a very long one, but for general idea, what is your idea about the cancer and how you can help cancer patients?
Well, I don't officially work with cancer.
Uh-huh.
When I first came to California, it wasn't legal to do alternative medicine for cancer, and so I
Wow.
don't really, but I support people. Cancer is, you know, one of the biggest health challenges a person can experience, and it calls on all of the seven keys. It calls on your faith, it calls on your trust in life, it calls on your physical balance, your ability to listen to your body and to find a unique lifestyle. These are all the seven keys, and to really tune into love. And so you're looking for a miracle when cancer is a challenge for you, but it is quite possible to live with cancer and have a great life even after chemo and radiation if that's what you end up doing. So what I say is there's always hope as long as you're alive. As long as you have living cells, there's hope, and to never give up.
So you never had a cancer patient, right? As
Oh, I
a
had lots of them
Yeah, you
over the
had
years. Many, yeah,
yeah.
yeah.
So these
So,
keys, like seven keys that you talk about them in your
mhm,
book, work for all chronic disease, as I'm thinking.
mhm,
Yeah.
yeah. I mean, the thing about difficult health challenges is that they're difficult. So it's
Yes.
going to seem impossible sometimes. It's going to seem really challenging. And that's the point of my book, is to help you have hope in a time when it seems so impossible that maybe you won't get through.
Yes.
Mhm.
Thank you so much. I really enjoyed talking to you, and thanks
Mhm.
for all the work you doing for your patients and
Mhm.
helping world,
Thank
healing the
you.
world.
Yeah.
And thanks for being here. That was my honor to be with you.
Thank you. It was my honor to be with you as well. Thanks.